Hi, this is Jenny Naders, acupuncturist at Alameda Acupuncture. These are 3 simple tests for the abdominal muscles. There are many ways to test the abdominal muscles. I like these because they're pretty straightforward and easy to do, especially if you're in a hurry. So the first test is for the rectus abdominis that goes straight up and down the fibers. The second test is going to be for the transversus abdominis, that is the wraparound fibers that are horizontal, might be, in Chinese medicine terms, maybe equate with the daimai. And then the third test is going to be for the external obliques and the opposite internal obliques. So external and opposite internal. So that's where we're kind of getting these cross-body patterns with the last one. Okay, so first test, rectus abdominis. You're going to bring the knees up and feet flat. If that causes any pain, we might be done here. But assuming it doesn't, we're going to bring the knees up, hips into 90 degrees of flexion, knees into 90 degrees of flexion. Bring your knees down just so your feet down. Perfect. Then you're going to cheat the hips back about 10 degrees to try and take the hip flexors out so that you can really get a good test of the abdominals. Now, hands by your side, breath in and out. Don't let me push you down. And relax. I always say and relax in between the tests, and I have them put their feet down and I kind of shake things out a little bit just to let everything really relax, because it can be a lot of work. If this test is weak, in this person it's strong, we've already needled them, but if it's weak, you're going to feel the feet go down, or maybe they might not even be able to hold their legs up against gravity. It might cause pain in the low back, pain in the SI joint. You might see the neck really tense up and try to get involved. You could see the whole upper body come up off the bed. But in a strong test, which is what you just saw, you're going to apply some pressure, you're going to feel the muscles engage, and you're not going to see a lot of movement otherwise in the body. The second test, transversus abdominis. That's the wraparound daimai muscle. So I'm going to put the knees into the same position that we just did for rectus abdominis, and then I'm going to ask him to do one more thing, which is to pull his belly button 1 inch towards his spine. So I'm going to bring his legs up, I'm going to do all the work, 90-90, then I cheat back 10 degrees. From here, pull your belly button into your spine 1 inch. I like to touch it to give him a cue as to where the motion should happen. Then breath in and out, don't let me push you down, and relax. A lot of times this test, even if the rectus abdominis was kind of strong when you did it, even though with this very subtle change, you'll be surprised to see how many people fail this test. Even Pilates instructors and people who are very much body aware and aware of transversus might fail this test. Okay. Third test, I'm going to bring the legs straight out, and I'm going to ask you to put your hands together for our position, and then straighten your elbows right up to the ceiling. And I'm going to have you breath in and out, don't let me push, and breath in and out, don't let me pull. Okay, so I'm not using a ton of pressure, I'm not trying to overpower him, I'm just trying to see, can he neurologically engage and can I really feel that muscle lock on. If this test is weak, when I pull, you're going to see the whole body roll, and when I push, you're going to see the whole body roll. So again, in this person, we've already needled, so they are not weak.